Hey folks, I just want to take a minute to talk about vitamin C and try to summarize it. It's an essential water-soluble vitamin. It has other names such as ascorbic acid and has been called the most popular supplement on the planet. It is essential because humans can't synthesize it and they must obtain it from their diet. So I'm just going to kind of summarize the things that I think are worth knowing, and essentially everything that I'm going to talk about is evidence-based and backed up by research or different studies that have been published. So its metabolism is readily absorbed in the gut from dietary sources, sort of straightforward. The body uses it for collagen synthesis, certain neurotransmitters such as dopamine and epinephrine, and it's also a cofactor for L-carnitine synthesis. I'm not really going to go over any of that in detail, so I would encourage you to look it up if you want to learn more. It does have a few benefits though. Generally speaking, it is thought to stimulate the immune system, strengthen connective tissue, and promote wound healing. It may also be an antihistamine. It is well known as a vitamin supplement taken to prevent and treat the common cold. I actually looked up the data for this. There was a 2013 meta-analysis of 29 studies. So meta-analysis when they combine all that data and try to draw one conclusion from 29 different studies. That did show a small but statistically significant 8% reduction in the duration of cold symptoms in adults regularly taking vitamin C supplements of at least 200 milligrams per day. In the general population, it does not reduce the risk of developing the cold or getting sick. It does appear to have a protective effect in highly active individuals who participate in vigorous exercise. In other words, the evidence is not strong that vitamin C is dramatically helpful. I mean, I did say only 8%. It is not dramatically helpful in preventing or treating the common cold in most people. Neurologically speaking, it may reduce the stress response, it may have some antidepressive side effects, and it may be protective against dementia and Alzheimer's. It does also appear to have some benefits to physically active individuals. It may promote, or appears to promote carnitine and collagen biosynthesis and antioxidant protection of skeletal muscle. The clinical significance, or excuse me, the significance to athletes is not known at this time. It does not appear to mediate the immune response during short duration exercise. However, as I mentioned before, it may reduce the risk of developing colds during prolonged exercise when supplementing with vitamin C. There are some big categories of vitamin C does not provide any benefits for. Has not been shown to reduce the risk of developing cancer, cardiovascular disease, coronary heart disease, cataracts, or macular degeneration. A deficiency in vitamin C is known as scurvy. It's characterized by bleeding gums, bruising, fatigue, and depression. This is where the term limey comes from, and that was used to describe 18th, 19th century British sailors who added lemons or lime juice to their rum to prevent scurvy during long excursions at sea. Toxicity, it's generally well tolerated. So if you're supplementing with 200 milligrams a day, that's a higher than the recommended daily allowance. And at levels at 2,000 milligrams per day, or 10 times that, it may cause some gastrointestinal disturbance. So you'd have to go out of your way to have a toxic dose. In pregnancy, it is a category C. However, supplementation is generally recommended during pregnancy and breastfeeding. Sources, some common sources besides just a pill supplement is our citric fruits such as limes, lemons, kiwi fruits, apples, vegetables, potatoes, leafy greens, and fortified cereals. The recommended daily allowance in males is 90 milligrams per day. In females, it's 75 milligrams per day. And in general, you should try not to exceed 2,000 milligrams per day, as I mentioned before. And that's basically it for vitamin C. Again, all this is evidence-based, and I hope you found it helpful.